All right. So, good evening, everyone. Welcome to Salone Health Educational Program. This evening, we will be presenting Salone versus COVID. My name is Dr. Denzel Cole. This program is aimed at providing information regarding the disease, symptoms, and preventative measures, as well as identifying credible sources of information. Salone Health is an organization of Sierra Leonean professionals dedicated to promoting the health and wellness of our people at home and abroad. We have several areas that we are focused on. As an organization, we are focused on health education and promotion for the Sierra Leone community, providing training and workforce development of valuable skills, as well as providing mentorship and networking opportunities. This is our way of giving back to the community, which has given us so much. Sorry. Please visit our website, Salone Health, for more information and resources. We are also available on Facebook, Instagram, and Twitter. We welcome all in our initiative.
All right. Salon people on a kusheo. So good evening, everyone. I am Dr. Fatou Forna. I am an obstetrician gynecologist and epidemiologist. So welcome again. We thank you for joining with us to learn about COVID-19 and how it's affecting our community. So before we get started, this is going to be a very interactive discussion today. So we want to hear from you. We want to hear about some of the questions that you have. So I'm going to pose this to you, members of the audience. Throughout this discussion today, send us messages. We will listen to them. We might not get to everything immediately, but we'll try to get to them at the end. So please send us your questions. So this is the Ask the Audience section. The first question we have, next slide. So we want to know, have you or anyone you know tested positive for COVID-19? We want to know how this is affecting the Salone community at home and abroad. So let us know. And when you are sending us that question, please also let us know where you are listening from. We know some of you are listening here in the US, and some of you are listening from Sierra Leone, from the UK, from everywhere around the world. So let us know where you are listening from, and have you or anyone you know tested positive for COVID-19? And I'll be sharing some of those answers with you, or with all of us. All right, we have Rahim, who's listening all the way from Portugal. Welcome. I know earlier we had someone who was listening from Houston. Send us those. Send us your questions. So we have Belinda from Atlanta. So welcome, Belinda from Atlanta. Yasmin is listening from Connecticut. Welcome, Yasmin. We're happy to have you join the conversation. People here, Salone people from all over the world, please send us your questions, your comments directly. We have Bomaya from New Jersey. Welcome, Bomaya. Ezekiel, all the way from France. Welcome. Khadija is from London. So thanks for joining us, Khadija. So we really have people from all over joining us. Hamida from Houston. So thank you for that. All right, so have you or anyone you know tested positive for COVID-19? And while we're waiting for those questions, I know personally I've had family members who've had COVID-19 here in the US, in the UK, so I know this is something that is really affecting us. So as those questions are coming in, maybe we can go to the next question. The next question is there anything that confuses you about COVID-19? We know it can be very confusing. What are some areas that are confusing that maybe you want us to talk about today? We have all these amazing expert Sierra Leoneans here to discuss with you. So let us know if anything is confusing that you would like to hear more about. I know there were initially some challenges hearing us. Sorry about that. I hope that everyone can hear a little better now. And if you are listening and you have the link, you're on Facebook, please share this so that other people can join, other Sierra Leoneans can join. So please share widely. We can also go to another question while people are thinking about if there's anything that confuses them. Another question is, what are your biggest concerns about COVID-19? What are your biggest concerns about COVID-19? So chat with us, share your questions, and if we don't get to it now, we will definitely get to it a little later. All right, so some of the concerns that we've been hearing are, people are worried about the fact that there's no vaccine. People are worried about the fact that we don't know how long this is going to take, when it's going to end. So we had, I had a concern come in. One of our listeners said, over here in the UK, Black and Asian people are more likely to die from COVID-19. However, the numbers aren't as high as in African countries. Does this have something to do with climate? So thank you for that. Those are areas that we will be going over. Does heat kill the virus? We actually have a section where we're going to be talking about, what are myths and what are real. So thanks for that. All right. So maybe while we have some questions coming in, we can get started, and I'm sure we will be able to answer a lot of those questions that you are sending in. Thank you for those questions. Next slide. All right, so I will start, and I'll give an overview of COVID-19, but today, expect that we're going to have different doctors, different public health practitioners who are going to talk to you about the disease, COVID-19. We're going to talk about some of the data, some of the many different areas of COVID-19. So we have different speakers and we will have different sections. And at the end, we will talk and answer specifically to some of the questions that have been coming up. Next slide. Okay, as I mentioned, just to give you a brief overview of the program, we've already had the introduction by Dr. Cole. I will be talking briefly about COVID-19, giving an overview, and then we will have Dr. Sharif, who will talk about COVID by the numbers. We'll have Ms. Kemokai talk about prevention and testing. Ms. Siddiq will talk about information sources. We have Dr. Metziger, who will be talking about mental health, which is so important. And then we'll have an open discussion, question and answer, testimonials before we close. So that's just an overview of the program today. Next slide. Next slide, and we'll start with an overview. COVID-19 has been really tough, I think for a lot of us. And I wanted to give some perspective. The pictures on this slide represent, they come from the New York Times. The New York Times in April of this year did an article where they shared photos from a century of epidemics. And basically, these pictures show that the different outbreaks and the different epidemics that we've been through as a world and that we've been able to overcome. So I want to go through a few of these just to let us know that we're going to be able to overcome COVID-19 also. We've had the Spanish flu in 1918 to 1919, which had an estimated 50 million people dying. The Hong Kong flu in 1968. We've had HIV in the 1970s and 80s with about 30 million dying. We've had MERS, we've had SARS, and we've had Ebola, which affected us in Sierra Leone with over 11,000 deaths. Next slide. Of course, we now have COVID-19, which is affecting us currently. And for COVID, we've had over 415,000 deaths. Next slide. So let's define coronavirus. Next slide. Coronavirus is a large family of viruses which can cause illnesses in animals or in humans. Mostly, they cause respiratory infections. They cause the common cold, for example, but they can cause severe diseases like MERS and SARS that caused a lot of deaths in the past. And most recently, of course, causing COVID-19, which is a global pandemic affecting many countries, but it originated in Wuhan, in China, in December of last year. Next slide. There are many, many, many cases around the world. COVID has affected nearly every area in the world, but you can see areas that have been hard hit have the deep red. North America, South America is now being infected a lot. Of course, there were many Asian countries, Europe, and you can see on the map Sierra Leone is affected as well. Next slide. The United States, of course, has been impacted. There are areas in the US that have been more impacted than the others. We hear a lot about New York, but in the South, Florida, Georgia, California, multiple areas areas have been affected. Next slide. Uh, COVID has affected different demographics and racial groups more than others. Here in the US, we know that African Americans are the group that has kind of been affected the most, highest rates of COVID infection in general, of hospitalization, and of death. Also Hispanic Americans, those are, and of course Native Americans. Those are some of the groups that have been impacted, showing the racial health disparities that we see with this example showing New York specifically, but we see this picture in other areas around the country. Next slide. Transmission, we know that the virus transmits mainly from person to person and is transmitted through respiratory droplets, so close contact. Next slide. How can we prevent transmission? You know, that's very, very important for us. You know, some of the things that we can do is washing our hands often, avoiding touching our eyes, our nose, our mouth, our face in general. Wearing a mask is very, very, very important. So making sure we wear a mask around others, making sure we cover our coughs and our sneezes, and cleaning and disinfecting surfaces frequently. And most importantly, one of our biggest tools we have is social distancing, making sure we stay far away, at least 6 feet from other people, you know, if we're in groups. Next slide. This, you know, is really a nice picture that shows some of the effectiveness of wearing a mask. If someone is infected with COVID and is not wearing a mask, and they're in close contact with someone else not wearing a mask, the protection there is very minimal, and your risk of catching the disease is high. If you wear a mask yourself and the person infected doesn't wear a mask, there's a little bit of a protection, but not a lot. But the most protection we have is when both people wear a mask, the person who has the infection and the person who doesn't. So we want to implore our communities, the Salone people there, let we make sure say we all they wear mask. That is one of the biggest tools we have to fight this disease. Next slide. We do have to protect our most vulnerable people. You know, people that are older, people that have comorbidities, you know, people that have infections, but we know with COVID-19, even people that we think are healthy can be infected and can be very sick. So the way we can help to protect our vulnerable people is limit your errands. If you don't have to go out, don't go out. If this is something that can be handled remotely, handle them. Avoid caring for children and those who are sick. You know, if you know that you're infected, of course, we want you to stay home. And socially distance yourself. If you have a member of the family who's sick, make sure that person is staying away from everyone else to try to minimize everyone getting that infection. Next slide. Staying home is very important. You know, these are pictures, you know, I believe it was last month in Atlanta, where when things opened back up, we had a rush of people going to parks. We had people at a mall. Those are things that really put you at risk for getting infected. So we understand that if you're critical, you have to go to work, you have to get groceries, you have to get food, you have to seek medical care. But if you can, try to stay home as much as possible. It will keep yourself and others safe. Next slide. You know, this you know, is a really nice graphic that shows some of the symptoms of COVID at the top. You might have a fever, you could have a cough, You can have difficulty breathing, muscle pain, tiredness. Of course, there are many, many other symptoms, but these are some of those symptoms. Social distancing, at least 1 meter or 6 feet apart. We talked about covering your cough, washing your hands, avoiding contact with sick people, minimizing human contact and contaminated objects. So we've talked about all of those things, and most importantly, using a mask when you're outside. Next slide. What do we do if we're sick? If you're sick, very important that you stay home. Very important that you monitor your symptoms. You get rest, you stay hydrated, and you call your healthcare provider to get advice. A lot of people that have COVID have mild illnesses and they can stay home and do symptomatic care. However, if you are sick and you feel like you are getting worse, you have shortness of breath, chest pain, you're not doing well in general, then you call your healthcare provider so that notify them about your condition and so that they prepare for you in case they tell you to come in. Covering your cough and sneezes, we've talked about that, washing your hands, often staying away from other people and not sharing personal items. Next slide. When you're sick, like I said, the majority of people can do well at home, but seek medical attention and call your doctor or your nurse if you're having trouble breathing, if you have chest pain, you're confused. And again, very important to call ahead. And in the US, of course, you call 911 for emergencies. Next slide. In the US, if you are home, it's very important, according to the CDC, there are certain things that have to happen before you can stop isolating at home and, coming back down to interact with your family, going out, things like that. You need to make sure it has been 10 days since your symptoms first started, and you make sure that your symptoms have improved. Your cough has improved, you don't have any fever without taking medication, and you haven't had a fever for the past 3 days. And if you were tested, it has been at least 10 days since you had your first positive test. Next slide. Treatment is very important. This is what we're all hoping for. Currently, there are no drugs, there are no vaccines, and no medications that have been specifically approved to prevent or treat COVID-19. However, we do know that a lot of experimental drugs are being tested. We are using some medications. Some studies have shown effectiveness, and we're hoping that we'll get to the point where we'll say we have a treatment for COVID. We're not there yet. Also, there are lots of vaccines in development. We know there's a rush. We're hoping that in the next year or so, we can have a vaccine. Again, all of that is in the works. What we can do is infection prevention and control, those things that I've talked about already, and supportive care. When you go to the hospital, giving you oxygen, helping you to breathe, helping with your fevers, things like that.